Dr. Velthera had practiced xenobiology for 47 standard years across 12 different species, but nothing in her extensive medical training had prepared her for the sight of the human limping into her clinic on Nexus Station. The Deathworlder's left arm hung at an unnatural angle, dark fluid seeped through tears in her clothing, and her face bore the kind of trauma that should have rendered any sentient being unconscious. "Excuse me," the human said politely, approaching the reception desk where Dr. Velthera's assistant sat frozen in shock. "I think I might need some medical attention." Medical technician Kickstell's bioluminescent patches flickered frantically as he stared at what his scanners were telling him. "Doctor," he whispered, his translator barely functioning, "you need to see this immediately." Dr. Velthera rushed from her office, her 4 eyes widening as she took in the human's condition. According to her visual assessment, the patient had suffered multiple compound fractures, severe lacerations, possible internal bleeding, and what appeared to be second-degree burns across 30% of her body surface. "Human," she said urgently, gesturing toward the emergency treatment bay, "please lie down immediately. You're in critical condition." The human, her identification badge read, "Specialist Martinez, Terran Engineering Corps," looked down at herself with mild concern. "Oh, this? It's really not that bad. I just got caught in that industrial accident down in Sector 7. The gravity generator exploded while I was doing maintenance." Dr. Velthera's medical training kicked in as she activated every scanner in the treatment bay. "Specialist Martinez, according to my readings, you have a fractured humerus, radius, and ulna. Your ribs show multiple impact fractures. You have internal hemorrhaging in 3 organs, and your neural activity indicates you should be experiencing pain levels that would incapacitate most known species." Martinez nodded thoughtfully. "Yeah, my arm's definitely broken. Feels like maybe a few ribs too. And I'm pretty sure I bit my tongue when I hit that bulkhead." She paused, considering. "Do you have anything for minor pain relief? Like an aspirin equivalent? Minor pain relief?" Dr. Velthera's voice rose an octave. "You're asking for minor pain relief? Well, I don't want to overmedicate," Martinez explained reasonably. "I've got a shift in 4 hours, and I need to be alert for the plasma conduit repairs." Dr. Velthera exchanged glances with her assistant, both of them trying to process what they were witnessing. In her decades of medical practice, she had seen Vordak warriors rendered unconscious by injuries half as severe. She had watched Crystalline Consortium members go into shock from trauma that wouldn't have warranted a bandage by human standards. "Specialist, you cannot possibly be planning to return to work today," she said firmly. "Your injuries require immediate surgical intervention and at least 6 weeks of recovery time." Martinez looked genuinely puzzled. 6 weeks? "Doctor, I appreciate your concern, but this is really just some bumps and bruises. Could you maybe set the arm and give me something to help with the swelling?" Against her better judgment, Dr. Velthera began running detailed scans. What she discovered defied everything she understood about biological responses to trauma. The human's pain receptors were active. She was indeed experiencing what should have been excruciating agony. But somehow, her nervous system was processing and compartmentalizing the signals in a way that allowed her to remain functional. Her cardiovascular system had automatically adjusted to compensate for internal bleeding. Her muscular and skeletal systems were already beginning preliminary healing responses. "Fascinating, Dr. Velthera murmured, studying the readings. "Your body is treating catastrophic injuries as routine maintenance issues." "Routine maintenance?" Martinez laughed, wincing slightly. "Doctor, this isn't catastrophic. Catastrophic was when I got caught in that reactor breach on Titan. Spent 2 weeks in the hospital for that one. This is just Tuesday." Dr. Velthera's worldview shifted fundamentally in that moment. She realized that her understanding of biological limitations had been based on every species except the one standing before her. Humans didn't just survive on a death world. They had evolved to treat death world conditions as normal operating parameters. Specialist Martinez, she said slowly, what exactly constitutes a serious injury by human standards? Martinez considered the question seriously. Well, if I couldn't walk or couldn't use both arms, that would probably require some time off. Or if there was actual organ failure, not just bruising. Internal bleeding's not usually a big deal unless you're losing more than a pint or two. A pint or two, Dr. Velthera repeated faintly. Yeah, the human body's got about 12 pints of blood, give or take. We can spare a couple without much trouble. Martinez paused. Though I should probably mention, I think I might have a minor concussion. I've been seeing double for the past hour. Dr. Velthera stared at the human, who was casually discussing symptoms that would put most species into intensive care. And you walk here with a concussion, multiple fractures, and internal bleeding because you thought you might need some medical attention? Well, I didn't want to be irresponsible about it, Martinez replied. Safety first, right? As Dr. Velthera began the surreal process of providing minor medical care for injuries that should have been fatal, she made a mental note to completely revise the medical protocols for human patients. Apparently, her previous understanding of Deathworlder physiology had been woefully inadequate. She also made a note to recommend that the station's safety protocols be upgraded immediately. If this was what humans considered minor injuries, she didn't want to discover what they would classify as actually dangerous.